Yeah, so mantle cell lymphoma, it's a relatively uncommon type of non-Hodgkin lymphoma and makes up less than 10% of all non-Hodgkin's lymphomas. And historically, it's been considered difficult to treat and has fared worse compared to indolent non-Hodgkin's lymphomas. But we have more effective treatments, including recently a class of treatments called BTK inhibitors, as well as a class of treatment called CAR T therapy. And so we were interested with the expanding options for treatment to look at how patients fare today at second and third relapse with the currently available treatments. Yeah, so we are part of an organization called LION, which stands for Lymphoma Innovations Orion Network. And it's a prospective study that includes 7 sites in the United States. And patients with relapsed non-Hodgkin lymphoma consent to the registry and then are followed and data is collected. The study doesn't dictate the treatments received, so it's purely observational, but it allows us to look at how patients in certain scenarios fare. And so we used the LION registry to look at patients with mantle cell lymphoma who had relapsed and looked at how they did with second and third line treatments. And so we calculated the estimated event-free survival and overall survival both at second and third relapse across the cohort. And then we did do comparisons looking at the types of treatments given and then also some of the characteristics between patients. Yeah, so what we saw that the outcomes for patients that were in this observational study were, I would say, better than what's been reported historically and better than what's expected. We saw that the event-free survival for patients at second relapse was approximately 26 months, and we saw that, moreover, the overall survival was very favorable, and so the 5-year overall survival was greater than 80% from the time of first relapse. And then similarly for the patients when they'd received third-line treatment, we saw that the event-free survival was approximately 19 months estimated, but the 5-year overall survival from second relapse was still greater than 70%, indicating that although patients did relapse, there were other effective treatments that they were able to respond to, and so they overall did better than we would have expected. When we looked at comparing the different classes of treatments, we didn't see any significant difference between patients that were treated with BTK inhibitors, which made up about half of the patients at second line and third line, between patients treated with other modalities. So the event-free and overall survivals were similar for those two groups. We did see that patients that relapsed early, that patients that relapsed less than 24 months tended to have a shorter event-free survival both at first and second relapse. And so I think that some of the implications of this research, which we do plan to seek out a validation cohort to validate, are that today the outcomes for patients with mantle cell lymphoma that are relapsed are better than what we have observed historically. And I think that needs to be taken into account when interpreting single-arm studies, which are often the type of studies that lead to at least accelerated approval for drugs in mantle cell lymphoma. And I think furthermore, this supports that looking at the time of first remission is relevant, at least for second line and third line treatment. And so that's one of the baseline characteristics that should be described when reporting out on studies for relapsed mantle cell lymphoma. Yeah, so, I mentioned there's 2 new classes of treatments that are FDA approved, and there are other treatments that are being developed and may be available in the near future. I think one of the areas that we still want to look at more closely is the patients treated with chimeric antigen receptor CAR T cell, because the numbers of those patients were fairly small in our study. And we also would like to just have a second cohort of patients treated around the same time, just to validate that in fact that the survival outcomes do appear to be getting better in the more recent era for these patients.